Tonight, state leaders warn of a rapid rise in the number of Coloradans in hospitals with COVID. We are in the middle of a surge like we have not seen since springtime.
But there's one major difference. The medical community is far more prepared for this stage of the pandemic. Here's a look at the hospitalizations over time. Right now, 417 people are still in the hospital with confirmed cases. That's the most since May 23rd. Now, if this trend holds, we will see those numbers, of course, go higher.
We are all very tired of the virus. Fatigue is setting in. That's why we're seeing these numbers increase. But the virus is not tired of us. It is still deadly. It currently has sent 417 Coloradans to the hospital. Many will make it out and some will not.
Now, on a positive note, more people are surviving COVID since the beginning of the pandemic. Daily deaths have remained in the single digits for months. April 22nd was Colorado's worst day, with 38 deaths due to COVID. Andrea, Flores taking a deeper look at these trends. Andrea's at UCHealth tonight, and doctors know a lot more now than they did in March and April.
That's right. Healthcare providers here at UCHealth are keeping an eye on the rise in hospitalizations. And one expert that we spoke with earlier today says they've treated hundreds of patients here at UCHealth over the last 7 months when the pandemic started. And that's helped them figure out what works and what they can improve on when treating COVID-19.
I was in there for 58 days. This is real.
Clarence Troutman is still on the road to recovery after contracting COVID-19 back in March.
I thought initially it was a really bad cold or flu, and it got progressively worse to the point where I just couldn't breathe, and I had a horrible fever.
He was hospitalized at UCHealth for months, most of it in a coma.
Initially, I was really upset, cried a little while, just kind of thinking, I've lost 29, 30 days of my life.
UCHealth Medical Director of Infection Prevention, Dr. Michelle Barron, says hospital treatment has evolved since the start of the pandemic.
Some of the things early on that we just wouldn't have thought of doing, like making people lie on their bellies even if they weren't necessarily requiring oxygen yet, intubating them sooner. Some of the medications that we have access to didn't exist at that time.
Doctors there are tracking symptoms and finding ways to treat it.
We also know that initially you may do better and then you could relapse, and so we now have things in place to keep an eye on people.
With hospitalizations on the rise, Clarence hopes his survival serves as a reminder.
Just be careful, because I don't wish this on anybody.
Now, even though Clarence is out of the hospital, his recovery is not over yet. He's still a patient here at UCHealth in the Pulmonary Rehab Center, and that's where he's working on things like strength and endurance, and he'll have some doctor's appointments through at least the end of the year. Reporting live in Aurora, I'm Andrea Flores, covering Colorado First.